Good day to you. I'm Professor Dr. Lawrence Field. I live in outside Austin, Texas, in a little German town called New Braunfels. I'm going to talk to you today about the beginnings of dermatologic surgery as a subspecialty before anybody knew it existed. It's of personal interest to me because I think, as far as I know, I'm the guy who started that. I want to tell you about those beginnings. When I was young, as I said, there was no such thing. I served in the Marine Corps in the United States, World War II, and was a reservist called up at Korea. So I have that background to help me in the fights I faced to try to gain knowledge. And dermatologic surgery has evolved because of my desire to learn more, to help my patients, because everywhere I turned for knowledge as a young man, the doors were all barred. Now, I tell you, I started in an internal medicine residency, and I have boards in that, for that matter. But in medicine, I became interested in cutaneous manifestations of dermatology, and that brought me to take both programs, get special certificates for it, eventually to become a consultant in dermatology at the University of Missouri when it opened its new facility, and I went there in 1958. I served there, and I served with surgeons, and I served with kidney specialists. I learned kidney biopsies, which I did. I was already expert with liver biopsies, which was very important to me. And with these early surgical experiences and two specialties, I was recruited to go to Saudi Arabia. So I went with Aramco, Arabian American Oil Company, in 1959, the first dermatologist in Saudi Arabia. I had the privilege of scrubbing with surgeons, two surgeons from American University of Beirut. Mikhail and Abdi were their names, wonderful surgeons. I scrubbed with ophthalmologists. I learned how to do simple cataracts. So when we went into the desert looking for glaucoma and trachoma, when he found simple cataracts, they were brought back to the Aramco hospital where we had tents by the highway, and I was doing simple cataract excisions of a slit in the lateral eye, expressing the cataract, putting in two absorbable sutures, and these marvelous old men would climb on their camels and go off into the desert, and we would never see them again. These were wonderful experiences. I scrubbed with the gynecologist because we had all kinds of ruptured uteri there from the Bedouin practice of packing the vagina of postpartum females, which then resulted in cicatrix. And if they got pregnant again by some miracle, they couldn't deliver, they would rupture. So they bring them in critical shape. So I helped all these people, which only increased my desire to learn more and more and more, so I could help the patients. When, after 4 years, Stanford was looking for someone to fill a post at Stanford, I went. I spent a couple of years at Stanford. Again, I helped every patient on the VA hospital. There was a mental patient who needed surgery. I brought them to Stanford for surgery. The surgical residents at Stanford would help me. If it was an ENT case, an ENT resident would help me. If it was around the eye, an ophthalmologic resident or faculty would help me. So from all these people, I gained knowledge. I gained techniques. I learned new tricks, and I started to see things that I could do better than they did. Somebody had taught me something different. So part of this message is go to surgery if you're interested with whomever you can, no matter who they are. They will teach you something. He who knows the most learns the most. He or she, new world, in my day it was he. But you learn by watching other people. And the more you learn, the more you know, the more you will learn. That's a fact. So when I finished at Stanford and there was an opportunity, there was no dermatologist in the whole state of California between the Bay Area and Santa Barbara. This huge area. So I picked the town of San Luis Obispo, one of the nicest communities in the country, best weather in the western United States. So I started my practice, surgically oriented, dermatologist, but surgically oriented. Terrific resistance against me, everyone. I got full privileges at the hospital. They were gradually taken away from me. Yearly reviews. Always the problem, you didn't have a surgery residency. You didn't have this. So another thing I have to say to you young people is, if you have a year to give, don't waste it on internal medicine. Don't waste it somewhere else. Go to a surgical residency in a small town that has a 1-year program and scrub with all their surgeons. That's the best thing you can do to prepare yourself for a life in dermatologic surgery, in my opinion. Pathology is good. I had a pathology fellowship at Stanford on dermato-oncology. I specialize in that, so that helped me very much when at the University of Wisconsin, I was I'm the oldest living person who was with Dr. Mose. This is before I was in practice. So I had a couple of years with him when it was his gopher. Hey, Field, go for this, go for that. Help me here, help me there. I learned a lot from Dr. Mose. What I didn't learn so well was to be humble, because he was a humble man, wonderful, always dedicated to helping people and learning the best ways he could learn and he was allowed to learn. So my life has been spent fighting my specialty. The chief of dermatology at Stanford loved psoriasis. I didn't like psoriasis. I hated psoriasis. But I learned all the liver biopsies. I delivered all the liver biopsies on methotrexate patients for years, not only at Stanford, but after I was in private practice. All of that exposed me to a lot of different thinking people, and all of that is important to what I hope you do in your exploration of dermatologic surgery, trying to remember my words. Learn from everyone something. I have scrubbed with hundreds of doctors, hundreds, and that's been a great privilege, but primarily a great learning experience for me to help my patients, and eventually to help others and to teach others, which I have done now for about 30 years and dedicated all the remaining of my life to teaching others and trying to open doors for you. They're difficult doors, and I know for some of you, they're still trying to suppress you. They're trying to murder your desires for learning. Don't let them. Form together, form societies, form groups that fight them so that you can have the right to expand your knowledge to help your patients. I thank you for this time, and I'm going to shut up now.